Sinusitis is the inflammation of the sinonasal pathways. It can be due to many different causes, including allergies and infections. Some of the common symptoms include facial pain and pressure, difficulty with taste and smell, or postnasal drainage. Patients can also suffer from recurrent infections, which can result in similar symptoms. If your symptoms of sinusitis have been occurring repeatedly or are not responding to medical therapy given by your primary care doctor, or if they're lasting days to weeks, it's time to see an ear, nose, and throat specialist. What really separates an ENT from a general practitioner is our ability to look behind the root causes of sinusitis. We have the ability in our office to examine the nasal and sinus pathways with cameras, or obtain a CT scan and do a comprehensive treatment plan which finds out the underlying cause of your illness before we decide a treatment plan. There are many treatment plans available. We start by offering the least invasive options, including medical management, but some patients may require procedures to fix their problem. Our goal is always to treat our patients with sinus disease with the least invasive option first. We often will start with medical therapy in an attempt to control their illness or disease. If the symptoms persist, we may then offer minimally invasive procedural options, which may include balloon sinuplasty or an endoscopic sinus surgery. Both of these treatments are performed entirely endonasally, meaning inside the nose, and allow for no external bruising or scarring, and allow patients to get back to life quickly. Functional endoscopic sinus surgery is the ability to go internally inside the nose using cameras to open up the sinus pathways in a natural fashion. This allows for better drainage, allows us to treat or resolve infections, but it does it in a minimally invasive fashion. Balloon sinuplasty is an in-office, minimally invasive procedure where after we make the patient comfortable, we can go inside the nose with balloon-like dilating devices and open up the sinuses to relieve their symptoms without a surgical procedure. This often is done in only a handful of minutes in our office, and patients can usually go to work in 1 to 2 days without any downtime.